Which medications are commonly used for OCD? So the most commonly used and first-line medications for OCD are the selective serotonin reuptake inhibitors. This includes medications like Lexapro, Prozac, Zoloft, Luvox. They all work equally well, and they all work by increasing serotonin. There are other medications out there that are used, though usually not first line. This includes medications like clomipramine, which also works on serotonin, but sometimes isn't tolerated as well. How do OCD medications work? The first line OCD medications work by increasing serotonin. For reasons we don't totally understand, increasing this neurotransmitter, or a chemical that is used for signaling in the brain, leads to lower states of anxiety, which helps people tremendously with OCD to be able to move past their symptoms. How long do these medications take to work? The first-line medications, unfortunately, do take a little time to work, typically in the 1 to 3 month range, and that's only once we've reached a dose that's going to be effective for you. Everyone's dose is a little different, and some people can get good benefit at fairly low doses, but a lot of people need higher doses to work. We generally will move up at your own pace, which is also going to be dependent on how you're feeling. And once we get to a dose that we think might work, we wait there for about a month, see how you're doing before we decide to go up any further. How do I know if the medication is working? The way we know the OCD medications are working is when you start to feel better. There's a few ways we keep track of that. One is that, people in your life might be commenting that you're seeming to do better. Also, your therapist or your psychiatrist will track using standard measures, for example, the Y-box, which measures your OCD symptom severity. Also looking at anxiety with separate measures, and can see how these numbers trend over time. The subjective experience is usually that you just feel like you're not as stressed anymore. Often the body symptoms of anxiety will go away first. And then when you get triggered and you have an urge, the urge is less intense, less sticky than it was before, and it's easier to do exposure response prevention or other psychotherapy work than it was before the medications. How do you decide when medications are necessary? I typically say that medications are never necessary or required because it's ultimately going to be your decision to make. Any decision that we make in life, including whether to take medications, has its own set of potential pros and cons or risks and benefits. There are risks of taking medications, which we'll talk about, but potential benefits. And when it feels like the benefits outweigh those risks to you compared to not taking medication and the benefits and the risks that you're experiencing without medications, people will often then try the medications. That can include when people have more moderate to severe symptoms of OCD, which we have seen are more treatable with medications than if you just do cognitive behavioral therapy or similar therapies on their own. Also, if you have other comorbidities, meaning if you also have depression or panic disorder or something else that's treatable with medications, that can be a really good choice. Also, if you've just benefited from medications in the past, or you have family members that you're biologically related to closely who also have benefited from medications, that means you're more likely to benefit as well. One more thing is if you feel like you're getting stuck in the therapy, kind of hitting your head against a wall, or it just feels too overwhelming to try to do exposures, medications can make that much more approachable or can help get you unstuck. Should I try medication or therapy first, or both at the same time? The decision about whether to try medications or therapy first is personal and depends on what's going on for you as well as what your preferences are. That said, therapy is almost always indicated as a first line, so it's very rare that we wouldn't suggest trying therapy for OCD right out the gate. The best therapy being typically exposure response prevention, though that's not a one-size-fits-all either. For some people, starting with just that is the best place to start because we can see a lot of improvement with therapy alone for some people. For people who tend to have other things going on like depression or panic disorder or other mental health issues, or have more severe symptoms, we will often recommend medications starting at the same time if those are things that you would like to try, if you're open to trying them. It generally doesn't hurt to try therapy first if you just want to do that and you're concerned about being on medications, because medications are treatment and not cure. But it's always good to have a conversation with a psychiatrist to discuss your specific case. What happens if I stop taking the medication? Stopping the medications is something that should always be done in consultation with your healthcare provider. The reason is it can be a different experience depending on which medication you're taking, what risks you have, what side effects you've experienced, etc. In general, stopping medication means you go back to an unmedicated state, which just means that however you were before the medication is how you're likely to be again. So if the medications weren't helping, then you probably won't notice much change. If they were helping, then they will stop working. It's not that they didn't do anything, it's just that they only work while you're taking them, like a blood pressure medication. If you're at a higher dose though, and also depending on which medication you're taking, you may actually need to have a slower ramp down in the medication, maybe over some weeks or even months in certain cases, in order to help prevent any sort of withdrawal. Withdrawal is not dangerous, but can be unpleasant, and it is something that you definitely want to discuss with your provider because it can be different depending on which medication you're taking. We avoid withdrawal by just being more careful, and that's why it's again super important to speak with your healthcare provider.